Today, you're going to see literal heart-stopping footage of people having heart attacks and cardiac arrests caught on camera. I'm Dr. Sharky and I'm a critical care doctor. My job is to snatch people from the jaws of death. We'll explore the frightening physiology behind these events. Watch till the end, where I'll let you in on some secrets on the more tragic side that most people don't know about. Because even if you come back from the dead, the life you end up living after a prolonged cardiac arrest might not be worth it. So let's dive in.
In 2024, this 83-year-old man collapsed at an ATM. 15 seconds later, a woman arriving for work rushed into her office for help.
I immediately knew that through my office doors, I'd have access to some of the world's best nurses, and I ran inside and screamed for help.
Her colleague, Whitney Sinowitz, jumped
that's
into
so
action.
lucky.
When I heard Kaylee screaming, checked for a pulse, which I didn't feel, and immediately started CPR.
Incredibly, the man's medical emergency was next to an office filled with nurse practitioners from Northwell Health on Long Island. Nurse Samantha Meglovich took over chest compressions.
I got down, on the floor with Whitney to help trade off CPR because it is tiring.
Yeah,
Nurse
CPR
Christina
is
Farrell.
very, very exhausting.
Right.
The importance of doing chest compressions is not to get the heart started, it's to keep blood flowing to the brain. The brain is very sensitive to the loss of oxygen and the brain cells will not regenerate once they die.
Into the office and grabbed the defibrillator, which was luckily in one of the rooms closest to the door.
She delivered an electric shock to his heart in hopes of restoring the heartbeat.
This gentleman was so lucky he had a heart attack right next to a bunch of nursing practitioners of all people, and there was a defibrillator right on hand. And this is so important to know because once he makes it to the hospital, we will know that the quality of CPR and chest compressions will be good, meaning there's a greater chance his brain will be okay.
I have an ER background. I just switched off with the girls when they needed.
They revived him and paramedics arrived, thanks to these heroes who were in the right place at the right time.
He didn't have a pulse, so if no one found him, he would have died.
The defibrillator, or what we call the automated external defibrillator, or AED, is a life-saving device that is kept in many public spaces. It's used to give a shock to the heart to reset it. As the name says, it's automated, so all you have to do is stick the pads on the chest of the patient and the machine will analyze the heart rhythm and if appropriate will deliver an electric shock. There is a myth that is popular in TV that every cardiac arrest is treated with a shock. That is not the case. There are two specific types of rhythm that can be shocked. If the heart is in what's called ventricular fibrillation, that is if the heart is just beating in a very irregular manner, or something called pulseless ventricular tachycardia, then a shock is needed.
Thank you.
Daniel Greco and his wife Bonnie later met the team that saved his life as he recovered from triple bypass heart surgery.
It's a miracle.
I see it and I still don't believe it. I don't know how you could thank people.
So, he had a triple bypass. That means he would have had quite severe blockages of one or more than one of the coronary arteries. These are the blood vessels bringing oxygen to the heart. That gentleman is lucky, and that is an understatement. But I have seen a few in similar instances to this situation. Having a cardiac arrest and there's a health professional close by to render aid, but to collapse in a building full of them, he should probably go out and buy a lottery ticket.
During a 2016 high school volleyball game, one of the players suddenly collapsed.
Oh my
You can
God.
hear when she hit the hardwood floor.
That's a young girl. That's not an old
She
person.
was in full cardiac arrest, so a coach performed CPR.
Now, this is more unusual. You're seeing a young girl collapsing like that. Now, that's scary. In young adults, the causes for cardiac arrest are a bit different to like what we saw earlier in the elderly gentleman who had blocked coronary arteries. In the young, a cardiac arrest will most likely be due to inherited disorders that stay hidden until they show up, like in a volleyball game or running a marathon. Diseases like hypertrophic cardiomyopathy, where the heart muscle is abnormally thick. Also, there are inherited diseases that predispose to cardiac arrhythmias. The good news is, usually they can be shocked back into a normal rhythm, and the younger you are, the better chances you have of surviving.
Then school administrator Julie Sermons rushed in with a defibrillator.
Life started to come back in her, and it was wonderful to see.
I had pain down my left arm and my heart felt like it was working really hard, but I just assumed I was out of shape.
Desperately praying. It was 4.5 minutes. I mean, it was a long time to watch them doing compressions, and definitely we thought we lost her.
Feel good, better than before.
Wow, so she was showing symptoms of heart pain. Pain that might not be in her chest, but going down the arm or up her neck. So you should never ignore anything like that, even if you're young and otherwise healthy.
Feel like good stuff? Yes, sit down.
In March of 2025, 53-year-old Jeff Goss and his wife Michelle were headed to an Arizona Cardinals football game when their living room surveillance camera caught his medical emergency.
Jeff came out saying he was nauseous, he was dry heaving, he was like coughing violently, and I kept saying, "What's wrong?" And then he kind of swayed, and I put him on the couch.
I thought it really wasn't that bad, and I kept telling her, "Don't call," that I was fine.
Your chest hurt?
Once he said his chest hurt, I was like, "Oh, okay, wait, this might be a heart attack."
This is having a heart attack.
She was right. Jeff was in the middle of a massive heart attack called a widowmaker.
It's kind of mild at first, but then it gradually just got worse and worse.
Wow, so what is the widowmaker? It's the fitting name given to the left main coronary artery, or sometimes to the left anterior descending artery. These are the large arteries that supply blood to the majority of the heart muscle, and a blockage in one of those can very well make your wife a widow, hence the name, the widowmaker.
59 minutes after Michelle called 911, Jeff was in surgery to unblock his artery with a stent.
The doctor told us
so
that
lucky.
it had been 10 more minutes that he wouldn't be here.
Interestingly, when you think of a heart attack, you think of the classic picture of someone gripping their chest and falling over in pain. But most of the time, a heart attack shows itself in more unusual ways. You might just feel some discomfort, cough, sweating, and nausea. These are all very common. A feeling of tightness or heaviness on the chest, difficulty breathing. Sometimes in diabetic patients, there won't be any signs at all, and you would have a silent heart attack. Now that's scary. This guy's wife was very smart and quickly figured out that he was having a heart attack, and it looks like he didn't go into cardiac arrest. So that's really, really great. Hope you bought some flowers. You owe her your life, buddy.
Mauricio later learned that as he was about to complete the deal, he suffered a heart attack.
He was sitting right there, and he leaned back, his head hit the wall.
The life-threatening episode caught on camera.
Convulsing. I didn't expect it to be real. I went, really? Because he had just told, who's going to tell you something's about to happen when it happens?
Even though Mauricio says he never had heart problems, it was real.
Didn't have heart problems that you knew about. Never assume your heart is healthy until you've had a full cardiac workup. I've seen so many unexpected heart attacks that it scares me sometimes.
In this video, you can see that moments after finance manager Bernie Lopez runs out of the room for help, workers at the dealership return and administer CPR. Minutes later, EMS workers arrived and took over from there. A hospital representative says Mauricio was without a pulse for about 5 minutes. He calls what he went through a Christmas miracle.
It's incredible how they react.
So that 5 minutes is what we call the downtime. The longer that downtime is, the lower your chances of surviving the cardiac arrest and the higher the chance of brain damage is. 5 minutes is a good downtime, if you can call it that. They're putting him on his side, but he's in established cardiac arrest. Yep, try chest compressions. Maybe a little bit faster, but that's fine.
Is there anything else to say? I've just got to tell them when you're breathing. Okay, now. So keep doing chest compressions, yeah?
That's correct. It's agonal breathing. He's not really breathing. So it looks like Mark started breathing in the middle of being resuscitated. But that doesn't mean his heart has restarted. Mark was experiencing something called agonal breathing. It's simply a reflex from Mark's brainstem in response to the extreme lack of oxygen to the brain. It's not a good sign. And there was some confusion whether his heart had restarted because of this breathing. But luckily they checked his pulse and confirmed he was still in cardiac arrest. And so they continued chest compressions.
Okay, now. Yeah, it's just what we've got to do. Mark, have you got a piece of tape over that? No,
So there you go. The paramedics giving the right depth and rhythm, so it's gotta be a bit faster.
Ready, set, lift.
That was great, but there are 3 disturbing facts about cardiac arrest that you might not be aware of. Number 1, not everyone survives. The amount of people who actually survive CPR is not great. Only 12% survive having an out-of-hospital cardiac arrest. And unfortunately, a lot of the patients we get in the ER with CPR ongoing just don't make it. What we see in the news and on YouTube is just a few success stories. Number 2, you might become a vegetable. Even if you survive and get your heartbeat back, the consequences of a cardiac arrest can be devastating. Depending on how long your heart was stopped, you could suffer from life-changing brain damage. And we even use scoring systems to predict how bad the neurological damage can be. The score that I use in my practice is called the Miracle 2 score, which takes into account your age, the type of cardiac arrest rhythm, and how much adrenaline you were given, amongst other things, and gives you a score out of 10. The higher your score, the more chances of suffering catastrophic brain damage. Number 3, recovery can be a long and grueling process. The examples we saw in the video were great success stories, but they fail to show the long and grueling recovery process, especially if the cardiac arrest lasted for a long time. A typical recovery would mean you would be in intensive care, on a ventilator or breathing machine in an induced coma. Because of the lack of oxygen, other organs might fail, like your kidneys, and you would need to go on a dialysis machine. You might have severe liver damage, again for the same reason. If you fail to breathe on your own after a prolonged stint on the breathing machine, you might need a tracheotomy, which involves making a hole in your neck to put a tube into your breathing passage to help you breathe and come off the breathing machine. There's so many things overlooked that need to happen before you make a recovery. And in most cases, this injury would stay with you for life. So what's the best way to prevent yourself from going to cardiac arrest? Just don't have a heart attack. But in all seriousness, just take care of your general health. Make sure you're physically fit and have a healthy weight. There is a test that can assess your risk of having a coronary event. It's called a CT coronary angiogram and calcium score. I have gone through this test in another video. The link is up here and in the description. I hope you found this video informative. Let me know in the comments what you think and please subscribe. Stay healthy, stay safe, and we'll see you in the next one.